Today I'm going to read the Rheumatology chapter from the Oxford Handbook of Clinical Medicine 9th edition. So at the same time I'm reading out loud so that any of you who is listening this record can also share my knowledge and some of the facts from the Oxford Handbook. Okay, so I'm going to start with the type of arthritis. So patterns of presentation of arthritis. So for the patterns of presentation of arthritis, we can generally divide into three: monoarthritis, oligoarthritis, which is less than or equal to 5 joints, and polyarthritis, which is more than 5 joints. So for monoarthritis, the type of arthritis that are included under monoarthritis are: number 1, septic arthritis; number 2, crystal arthritis. Under crystal arthritis, gout, CBBD also included, and osteoarthritis and arthritis caused by trauma, for example, hemarthrosis. So these are the under monoarthritis. Oligoarthritis, crystal arthritis, again it will be involved under oligoarthritis, and psoriatic arthritis, reactive arthritis, which follows the infection like Yersinia, Salmonella, Campylobacter, and ankylosing spondylitis, osteoarthritis. So osteoarthritis can be under monoarthritis or oligoarthritis. Okay, polyarthritis. So polyarthritis means arthritis more than 5 joints involvement. It can be differentiated into 2, symmetrical and asymmetrical. So symmetrical means it will be involved in the both sides, left and right side. So in the under symmetrical included are the rheumatoid arthritis, osteoarthritis, viruses, for example, hepatitis A, B, C, and mumps, and systemic conditions. They can also cause symmetrical. Asymmetrical means reactive arthritis. So reactive arthritis can be oligoarthritis or polyarthritis. Which when it is polyarthritis, it can be asymmetrical, and psoriatic arthritis as well. Okay, so these are the general patterns of presentation of arthritis. Okay, so examination of the locomotor system. I'm not going to talk about read about detail and of the assessing the locomotor system. So let's go to the synovial fluid appearance. So synovial fluid appearance is very interesting because it will be after joint aspiration. So normal synovial fluid is clear, colorless, and viscosity is more or less normal, and cell WBC count is less than or equal to 200, and there is no presence of neutrophil. Okay, so what will happen if a person has OA? Clear or maybe straw-like color, viscosity is a little bit more higher, WBC 5 times higher than the normal. That means 1000 equal or less than or equal to 1000, and neutrophil less than or equal to 50% of the blood concentration. Hemorrhagic. So hemorrhagic is quite obvious. The appearance will be bloody or xanthochromic, that is the yellowish appearance, and viscosity can be varied, and WBC got definitely 10 times higher than the OA. That means like 10,000. Neutrophil, not that much. Okay, acutely inflamed. We can see that in acute inflammatory reaction, WBC count will be super high. So it can be up to 50,000. Neutrophil, in rheumatoid arthritis, neutrophil, there will be no neutrophil. But if it is crystal arthritis, that means gout or PCCP, then neutrophil will be less than or equal to 100% of the blood concentration. So which one will be the highest neutrophil? It's very obvious if it is a septic arthritis. Okay, so this is a synovial fluid appearance, and now we are going to radiology. So radiological appearance, there is these are 3 diagrams. The major diseases and most common diseases in the rheumatology, that is osteoarthritis, rheumatoid arthritis, and gout. So osteoarthritis will be LOSS, loss. So what is LOSS? Loss of joint space. Joint space will be narrow. O stands for osteophyte formation. S stands for subarticular sclerosis, and now another S stands for subchondral cyst. LOSS. Loss of joint space, osteophyte formation, subarticular sclerosis, subchondral cysts. Okay, this is OA. Rheumatoid arthritis, just articular osteopenia, soft tissue swelling, joint deformity, and loss of the joint space. Okay, gout. Punch out lesion, periarticular punch out erosion, normal joint space, soft tissue swelling. Normal joint space, soft tissue swelling. So, rheumatoid arthritis and gout. Rheumatoid arthritis, joint space is lost, and gout, the joint space is maintained, normal joint space. Okay, back pain. This is one of the very commonest symptoms in rheumatology. So back pain is very common, often self-limiting, but be alert to sinister causes, that is malignancy, infection, or inflammatory causes. So back pain is super common, and sometimes it can be self-limiting. So what are the red flags? Some back pain is very common, but the red flags, if your patient give this history, any of this history, you should be aware of it. Number one will be age. Very young or very low. Very young means less than 20. Of course, at around 20 or 30, the bones are still okay. You can enjoy everything. But if you have persistent back pain at less than 20 years of age, that's an alarming sign. Okay, so acute onset in elderly people. Elderly people can have back pain, but if it is acute onset, it is a red flag symptom. Consistent or progressive pain. Instead of relieving, the back pain is persistent and progressive. Nocturnal pain. You cannot sleep at night. Worse pain on being supine. Most of the pain relief on sleeping position or supine position, but if the pain wasn't on supine position, it is an alarming sign. Fever, nice sudden weight loss. There can be underlying problems, and a history of malignancy. The previous history of malignancy, we should always aware that it can be the secondary metastasis and associated abdominal mass. That means like the patient can have other associated disease. Thoracic back pain. Most of the time back pains are like more or less lumbar area, but if you have the back pain in the thoracic region, if your patient has the back pain in the thoracic region, this is an alarming sign. Morning stiffness, that a particular time, the pain occurs in a particular time of the day. So that means this is not just a trauma, this is representing another condition. Bilateral or alternating leg pain. Sometimes the leg pain, if you have an injury, like you can have the Achilles tendonitis on your right leg. But if you have the herniation on the both sides, that represents there is an underlying disease or disturbance. Alternating leg pain. Like one day it disappear, and then another 2 days disappear, and after 4 or 5 days it appears again. Alternating leg pain. Or if it's like left and right legs are having alternatively. Neurological disturbance. Leg pain is pain in the bone or maybe the muscle, but if there is a neurological symptom, it is always assured that it can have other CNS involvement. Sphincter disturbance, that is autonomic disturbance. And infection, if there is a previous current infection or recent infection, that represents another big disease. Immunosuppression, that is also an alarming sign. And leg claudication. Leg claudication means the patient cannot walk. After some time, the patient cannot walk, and she has to sit down and rest. Exercise-related leg weakness or numbness. Sometimes if the patient will give the history of leg weakness after an exercise or exertion, and relief by sitting position. That is representing another condition. For example, spinal stenosis. Okay. So I will skip out some of them. Examination and nerve root lesion. So nerve root lesion is like very confusing every time, but nerve root pain, if it is L2, 3, 4, 5, S1. So we are going to talk about 5, L2, 3, 4, 5, and S1. So L2 is across upper thigh, hip flexion and adduction. If it is across the upper thigh, it can be like hip flexion and adduction. L3, across the lower thigh, hip adduction and knee extension, knee jack. So L3 means across the lower thigh, and it can affect the hip adduction and knee extension, so that it can affect the knee jack. So L3, knee jack. L4, also knee jack. Across the knee up to medial malleolus. And L5, grade toe jack. L5, grade toe jack. Lateral shin to dorsum of the foot and grade toe. S1, ankle jack. So all in all, if you are going to combine L3, L2, L3, 4 knee jack, L5, grade toe jack, S1, ankle jack. Okay, so I'm going to stop here, and in the next one I'm going to talk about osteoarthritis and septic arthritis. Going to read osteoarthritis, septic arthritis, and rheumatoid arthritis. Okay, see you again. Thank you.